Good afternoon. Welcome to the Mayor's Commission for Citizens with Disabilities meeting on November 27th. We had a pre-meeting with the members where we discussed some upcoming work and accessibility related work with the Department of Human Rights and Relations and discussed our schedule for 2024. We have rebroadcast of our meetings at 5 p.m. on Monday evenings on channel 22. You can also get videos of this and past meetings at the Disability Commission website, which is if you go to www.cityofomaha.org and click on the Mayor's Office and then click on Disabilities Commission, you'll find the videos there. The commission is the Omaha Advisory Commission for Citizens with Disabilities, and the objective of our commission is to promote quality of life, accessibility, and equity in all aspects related to the city of Omaha on behalf of and in cooperation with the citizens of Omaha who experience disability. In this work, we will advise the mayor on issues of access, representation, employment, housing, and quality of life affecting city citizens with disabilities and their respective families. We will serve as a resource for Omaha citizens with disabilities and their families to express concerns and resolutions regarding issues affecting them. We work to publicize to the citizens of Omaha the role of the Mayor's Advisory Commission for Citizens with Disability and the resources available to assist citizens with disabilities and their families, employers, housing representatives, business owners, engineers, and architects, and others who have a role in bettering the life of Omaha citizens. And we serve to advocate for accessibility issues at public buildings and infrastructure governed by city codes and ordinances, and issues affecting employment of disabled persons in city government, and recommend to the mayor policies to improve accessibility and employment with the City for Citizens with Disabilities. And with that, we are going to move into our public meeting and want you to make sure you kind of keep a pen and paper handy for information that comes about or announcements that we will try to get to at the end. And we're going to go through and do some introductions of those members of the commission and representatives of the city that are here. I'm Megan Walls. I am the interim chair for the Mayor's Commission for Citizens with Disabilities. Previously the vice chair, been involved for several years, and I work in disability inclusion kind of across the lifespan and in a variety of different areas of impact. So I'm kind of here with that lens today. Natalie?
Hi,
Turn your mic on.
I'm Natalie Simmons, and I am the secretary of the commission, and this is my second term, and I'm a grant writer with Dotted Eye Writing Services.
And I'm Nancy Floral, and I recently retired from the Nebraska Commission for the Blind and Visually Impaired. We're the vocational rehabilitation agency that serves individuals that are visually impaired, blind, and deafblind, and so often individuals also experience a secondary disability.
Hello, my name is Ashley Wolf, and I work for the Nebraska Commission for the Deaf and Hard of Hearing, and I provide services to deaf and hard of hearing individuals and citizens around the state.
Nina, do you want to introduce yourself, please?
Hi, I'm Nina, and I represent the Jansen's Foundation, which is a rare skeletal disease that affects less than 30 people worldwide. I'm also a person with a disability, a physical disability. I'm a caregiver to two boys who also have an inherited disability. We all use wheelchairs, and so I'm happy to be here and share with this community.
Thanks, Nina. Andre?
Hello, everybody. My name is Andre Partridge. I'm a fairly recent graduate from University of Omaha, Nebraska. Wait, University of Nebraska Omaha, and uh, uh, I'm also representing tongue tied. I represent autism on the autistic people in Omaha, as I'm also autistic myself.
Awesome. Thanks, Andre. You guys want to introduce yourself?
Hi, I'm Kaylin DeHelius, the Director of the Human Rights and Relations Department for the City of Omaha.
And I am Christian Espinosa, the Assistant Director of the Human Rights and Relations Department. Thank you.
Keith, are you with us to introduce yourself?
I am. Hello, Keith Station, Deputy Chief of Staff for Diversity, Equity, and Inclusion in the Mayor's Office.
Fantastic. We've got a great group here today. We do have a quorum, even though we didn't necessarily need to vote on anything officially. The meeting minutes will be approved next month once everyone has had a chance to go through them. And so we'll move on to our guest presenters for the day. We're focusing on a topic around mental health and wellness. And so we have a few different great presenters. We have Jennifer Mucky, Quality Improvement Manager with Community Alliance, Dave Pantos, an attorney, and Sadie Hinkle, Program Director of the Kim Foundation. So we will hear from all of them starting now, I guess. Do we know who is starting? I just get to call on someone? That's really fun. Well, your name's first on the list, Jennifer, so let's start with you.
Sure. This is where I'm standing, right here. Thank you. Thank you for having me here today. I have been with Community Alliance for 28 years and have had a number of different roles in the organization, and I love talking about all of the services that Community Alliance has for the Omaha community. Community Alliance has been in Omaha for over 40 years, and we are well rooted off of 40th and Leavenworth. 4001 Leavenworth is our address. We are currently building a new facility down off of 72nd and Mercy in the Exarban area, and we will be hoping to provide services in spring of 2024. Community Alliance is known in the Omaha community for just grassroots community mental health services. We were an agency that was started by families, and we still, to this day, uphold the value of family involvement, community involvement, and wellness in recovery of all individuals. Community Alliance offers a variety of different services under the mental health umbrella, in addition to co-occurring and substance use services as well. We look at holistic and integrated health care that involves mental health, physical health, social well-being, contribution, and purpose. Some of the services that we have at Community Alliance are what I guess you would say maybe non-traditional mental health services. So when we think about seeking out mental health services for ourselves or for our loved ones, we traditionally look for outpatient therapy or psychiatry. Community Alliance has an integrated health clinic that not only has that therapy and that psychiatry both on-site and telehealth, but we also have a primary health service as well, where we have MD right there available for individuals, because we know that health is mental health and mental health is health. It's all under one umbrella. So Community Alliance also has an on-site pharmacy for individuals to access as well, so they can have all of their healthcare needs met. One of the beauties of our integrated health clinic is that we also have care coordinators that are established within that clinic. So if there are individuals that are seeking services within the clinic, they have an individual care coordinator that's going to help navigate those somewhat tricky health roads that individuals may go down. They'll help close the loop with referrals and specialty referrals, and then really focus on the individual and that relationship to keep them engaged in services and be partners with them in their health journey. So with that care coordination piece, we value that with that individual and the family. There's a lot of networking and navigating and that relationship building and trust. So then when people are accessing health services, they have somebody that they can partner with and advocate for them on behalf of their well-being. In addition to our integrated health clinics, we have a variety of community-based services. One of the services that I've spent most of my time in at Community Alliance is a day rehab setting, and that is for individuals that either have not had a work history, may need some structure during the day. It's a Monday through Friday program that offers a variety of different life skills, learning opportunities for not only mental health, but wellness and holistic health. There is a great component of social and relationship building, community building skills within that day rehab program. You'll find that people that have come into mental health services may have lost family connections or friend connections, and that's one piece that Community Alliance helped put that puzzle back together of reestablishing those relationships with people that need that social connection and that are seeking out, maybe broken relationships with friends and family. So the day rehab program is an on-site program Monday through Friday that Community Alliance has had in place for a number of different years. In addition to that rehabilitative program, we also have community support services where individuals actually go to the person out in the community, and they help with, again, not only having that person live successfully on their own, but manage, again, any type of community needs that they may have, whether it is financial or being successful living on their own, relationship building. It's a one-to-one relationship that we have. We also have employment services at Community Alliance. So if somebody is interested in returning to work, they can work with a supported employment specialist to not only help them with interview skills, job seeking, but then also making sure that they are sustaining employment and meeting some of those employment and professional development goals. We offer a variety of homeless outreach services at Community Alliance. So we have a team that partners with other types of community services in the Omaha community, and we help those individuals that are on the streets, in shelters, to help them access basic needs such as food, clothing, shelter, help them get into services, and then start building that trusting relationship with them to see what other needs that they may have. We have just expanded services to where we're offering substance use therapy services, and we'll continue to explore ways that we can build on that need in the community for both mental health and substance use. Community Alliance also offers a peer-led program, which is called Safe Harbor. And Safe Harbor is ran by 100% peer support specialists, which are individuals that have had lived experiences with mental health. It is a 24/7 crisis management site that individuals can be invited to come and attend if they're going through any type of emotional struggle, as well as having a 24-hour warm line that's available for people to access within our Safe Harbor services. We have a variety of housing available at Community Alliance to include residential rehab services for those individuals that need more stability before they're able to return home. And then we also have apartment programs and intensive apartment programs within our community support programs that individuals can access as they transition back into independent living. There's just a lot of value, again, with community building in those residential homes that help people in their wellness and being able to transition back into the community. We offer a specialized case management program for individuals that may have not accessed Social Security or Medicaid types of services. So those specialized case managers will help with navigating all of those systems to ensure that those entitlements are expedited for them in a timely manner. We offer a variety of wellness programs within our integrated care clinic to involve smoking cessation programs, health and wellness services, and any other type of family education and support that individual or family may need. So I want to thank you guys for your time, and let me talk about Community Alliance. Do you guys have any questions? No? Okay. There's going to be a slide put up for more information. You can visit our website at communityalliance.org. You can call 402-341-5128 and visit us on Facebook at Community Alliance or Instagram at CA Omaha.
Yeah, awesome. Thank you, Jennifer. Don't run away. I'm sure there are going to be some questions.
Okay.
I have several.
Yes.
Are we going to ask now or at the end?
I
Shall
think
we
it
ask?
probably makes, now.
Okay. Well, Jen, I was just wondering when
Yes.
the Safe Harbor The peer run program, it's a
Yes.
24/7. Is that open to anybody?
For
In
adults
the
19
community
and
that
up,
might be
19 and up,
struggling?
yes, it's for adults 19 and up that are needing support for any type of emotional crisis, and it's not an inpatient psychiatric, it's more of a crisis, kind of a wellness recovery, less 24/7, so less than 24/7, they can stay and have trained peer support specialists there to help them through that crisis.
So in order to access, they would just contact Community Alliance and they would get connected with Safe Harbor.
So they would call, yeah, you can actually call Safe Harbor directly, and you
Okay.
can talk to peer support specialists there. And through that conversation, then they will talk you through and help you access that service. Yes.
Okay.
This is Ashley. I do have a follow-up question in regards to Nancy's. So for the Safe Harbor, oh, I'm sorry, just to give you a heads up, just look at me.
Okay.
Even though the interpreter is speaking, you can look at me.
Okay. Oh, hi.
I'm the one that's talking, sorry.
Okay.
Anyway, so for the follow-up, as far as calling, so do those advocates understand about services for VRS or VRI? Like, so a person that may be calling that uses sign language, and so is calling through an interpreter, through VRI or VRS, or even those individuals that might be deaf and deaf-blind, do they have an understanding of that service?
Yes, so they're provided training on how to access services for people that may have hearing disabilities, and they have ways that they're able to communicate with that individual. We have that across all of our programs, as well as translators for people that are non-English speaking.
Okay.
Great, thank you. I still have another questions if I can, otherwise I'll let someone else ask first.
Go ahead.
For the day program, do they have to sign up to access that?
Sure.
Or do they just show up?
That's a good question. So we have a comprehensive assessment program at Community Alliance, and they are able to call, or they can actually call, or we do have walk-ins, so they could walk in and access a comprehensive assessment team that's going to help that individual complete all of the paperwork and all of the intake process to access services. So they can either walk in, or they can call and schedule an appointment. And through that assessment process, then they can set their plan to a 10-day program.
Okay, so that's obviously an answer for people that may have an appointment, but if they just walk in, how does that happen? How do you access communication?
Yep. So we have an intake team that helps that individual that's just walking in. So if somebody comes into our main office, we have a receptionist there, then we're able to have that intake team help that person access services and walk through the comprehensive assessment process. So there are certain comprehensive assessments and like releases of information, any type of traditional intake paperwork processes that a person would go through when they're accessing services.
I think what she was asking, if I'm correct, was if there's a walk-in and they have an accommodation need, a communication accommodation need, they need an interpreter, like how do you meet that need for a walk-in when you don't have any?
Sure. So we would partner. We have access to being able to provide that service for the individual.
Okay, so you mean you have like a video relay service set up for
Yes.
that?
Yes.
They're available.
Awesome. In the interest of time, I will reserve most of my just curious questions, but I think one, can people access your services whether or not they have insurance?
Yes. All of our services, we are able to provide services for anyone that's seeking services. Now, some of our services have requirements that are insurance-based, but we also have a sliding fee scale, and if that's needed.
Okay, awesome. Any other questions? Any from online or any here before we let her sit down? No? All right. Thank you so much for all the information, Jennifer. Dave, you're up next.
Oh.
Thank you. Hi, everyone. My name is Dave Pantos. I'm a local attorney. I've been licensed for 27 years. I've done a fair amount of work in the area of mental health and disability. For a couple of years, I was executive director of Autism Action Partnership. I spent several years representing disabled people, helping them get SSI disability and Social Security disability. And I work with a fair number of people with estate planning when there's issues related to their mental or physical health. I just want to say thanks for having me here. This is a great commission. I really respect the work that you're doing. It's so important, especially given the huge growth in the number of people facing issues related to mental health. Another problem which is really growing significantly is the issue of long-term care. It's a huge crisis. Recently, a national newspaper and the Kaiser Family Foundation did a series of articles with headlines like "Dying Broke" and "Facing Financial Ruin," why long-term care insurance falls short for so many. It's a huge crisis. So I wanted to talk a little bit about Medicaid and long-term care because it does have a huge overlap with the communities that you're serving. And certainly in a state like Nebraska, where we have an aging population, we have a growing number of people facing mental health disabilities, it's something we all should be focused on. The fact that in reality, to get long-term care, you really do have to go broke to really be able to get it, and it's a huge issue. So I wanted to talk about that a little bit. First of all, so I'll just go through a couple things. What is Medicaid? Medicaid was authorized by the Title 19 of the Social Security Act in 1965, same time as Medicare, as part of what was called the War on Poverty. All states, DC, Nebraska, all the territories have Medicaid programs designed to provide health coverage for people with disabilities, people who are low income, and elderly people. And then more recently, we had the Affordable Care Act. And I'm realizing I should probably have the slide advanced. Is there, do I just do that? There's a mouse. Of course there's a mouse. This is literally, like I teach a class and this is literally the same setup, and yet somehow I just have no idea what's going on. Okay, moving on. Okay. Cancel. Okay. Yes, spiraling costs, we're good. What is Medicaid? Here we are. Okay. So yes, there was the Affordable Care Act, which expanded Medicaid eligibility for states that decided to expand Medicaid. Some states did not. Some states did through initiative and referendum, like Nebraska. So that's the basic gist of Medicaid. So what part of Medicaid involves long-term care? And why is it really important? Because Medicaid is that primary provider. Okay, I need to catch up here. Okay, good. So in addition to health coverage, Medicaid covers certain kinds of inpatient comprehensive services, such as institutional benefits. Institutional has several meanings, but for a particular meaning for federal Medicaid requirements, institutional services refers to specific benefits authorized in the Social Security Act, such as hospital services, intermediate care facilities for people with intellectual disabilities, nursing facilities, pre-admission screening and resident review, inpatient psychiatric services for individuals under age 21, and services for individuals age 65 or over in an institution for mental diseases. So institutions are residential facilities. They assume total care of the individuals who are admitted, et cetera, et cetera. So let's go. Okay. So let's talk about requirements for Medicaid nursing home coverage. Who provides nursing facility services in these contexts? Nursing facility services are provided by Medicaid certified nursing homes, which primarily provide three types of service: skilled nursing or medical care and related services, rehabilitation needed due to injury, disability, or illness, and this includes mental illness and mental disability, long-term care, health-related care, and services above the level of room and board that are not otherwise available in the community. And a nursing facility is one of those many settings for long-term care. It's really kind of that last resort for so many people who don't have their own insurance and are forced to kind of spend down their resources. So where are these nursing facility services provided? Medicaid coverage for nursing facility services is available only for services provided in a nursing home licensed and certified by the state survey agency as a Medicaid nursing facility, also just known as an NF or MNF. Medicaid NF services are available only when other payment options are unavailable and the individual is eligible for the Medicaid program. So who can receive these nursing facility services? These nursing facility services, or NF services, are required to be provided by state Medicaid programs for individuals age 21 or older who need them. States cannot limit access to these services or make it subject to waiting lists, as they may for other kinds of community-based services. So in some cases, NF services may be more immediately available than other long-term care options. NF residents and their families should investigate other long-term care options in order to transition back into the community as quickly as possible. So what services are included in this nursing facility benefit? An NF participating in Medicaid must provide for or arrange for nursing or related services and specialized rehabilitative services to attain or maintain the highest practical physical, mental, and psychological well-being of each resident. But there's no exhaustive list of these services, so it really kind of depends on unique residential needs of that particular individual. Okay, next slide. Waivers and institutional care. So waivers are really important in the institutional care context. Within broad federal guidelines, states can develop home and community-based service waivers, or HCBS waivers, you may have heard of those, to meet the needs of people who prefer to get long-term care services and supports in their home or community rather than an institutional setting. Nearly 1 million individuals right now nationwide are receiving services under HCBS waivers. These first became available in 1983 when Congress added Section 1915C to the Social Security Act, giving states the option to receive a waiver of Medicaid rules governing institutional care. And then in 2005, HCBS became a formal Medicaid state plan option. And so several states include HCBS services in their Medicaid state plans. And there's 47 states throughout the country that are, and DC, that are operating at least one 1915C waiver. Okay, so let's talk about Medicaid eligibility requirements. And this is what really comes down to this issue of folks going broke or dying broke. Determining Medicaid eligibility. The first step is financial eligibility, and you kind of see these tests for things like SSI, Medicaid, and other programs that are created for people who have needs. But unfortunately, so many people need these programs, they can't afford them, but they may not be poor enough to get them right now, so they have to kind of spend down their resources to be able to become eligible for them. So financial eligibility is the first thing we look at. The first thing that evaluators look at is modified adjusted gross income. This is used to determine financial eligibility for Medicaid, for programs like CHIP, and other things like premium tax credits and cost sharing reductions available through Health Insurance Marketplace. This is also the basis for determining Medicaid eligibility, income eligibility for children, pregnant women, et cetera, et cetera. So Some individuals, however, are exempt from modified adjusted gross income-based income counting rules, including those whose eligibility for Medicaid is based on things like blindness or disability or age. So when we're talking about people who are basing it on like disability, and we're talking about disabled under the Social Security Act, not just unable to work, et cetera, we don't look at those key factors. Other exemptions, if you have applied for SSI and you've been approved by the Social Security Administration, in most states that is the same as becoming eligible for Medicaid in those states. When I practiced in New Jersey, your application for SSI was an application for Medicaid. Nebraska, it's almost the same, but not exactly the same. There's kind of a separate process, but if you're found as eligible for SSI, you will be found eligible for Medicaid. But there's also non-financial eligibility requirements, things like residency, immigration status, naturalization status. It's this whole other can of worms that we have no time to get into today, but it is very complicated and does change over time with politics and congressional acts. Okay, effective date of coverage. Once an individual is determined eligible for Medicaid, coverage is effective either on the date of the application or on the first day of the month of the application. So that's really key. But let's talk about some of these things, which are really what kind of cause people problems. Look back periods, penalties, and other eligibility issues. First one is spousal impoverishment. So if you're using Medicaid to get coverage for long-term services and supports, the spouse of a Medicaid applicant is protected from impoverishment. Basically, that just means that if they're going to come after you for payments and all that, the individual dies, there's money owed, they don't go after the spouse right away. They wait until that person also dies, and then they go after the estate. I've definitely worked on these cases where that next generation is very surprised to see Medicaid coming after them for like $50,000, $100,000 because of some unpaid bill, but they don't impoverish the spouse, so that is good. Treatment of trusts. When an individual, his or her spouse, are acting on the individual's behalf, establishes a trust using at least some of the individual's funds. That trust can be considered available to the individual for determining eligibility for Medicaid. So that does kick out a lot of people. And again, it explains why so many people are going broke to get long-term care. Transfer of assets for less than their fair market value. And I've advised a lot of people about this. They're like, well, I have this house, I have this money. Can I just give it to my kids or my grandkids so it doesn't count against me? There is this 5-year look back for transfers of assets that are less than fair market value. So if you don't sell your house to another person, and again, a house can sometimes be exempt, but I'm talking about other kinds of assets, they will look back 5 years. So that really does catch a lot of people, which again is why this has become such a crisis for people with mental health issues, with who are seniors, et cetera. Estate recovery. State Medicaid programs, and I will say this, they're very aggressive in trying to get this money back from estates and from families. State Medicaid programs must recover from a Medicaid enrollee's estate the cost of certain benefits paid on behalf of the enrollee, including nursing facility services, home and community-based services, and related hospital and prescription drug services. State Medicaid programs may recover for other Medicaid benefits as well. So again, this is another key issue for folks to keep in mind. Applications for Medicaid, typically you apply for Medicaid at the State Department of Health and Human Services. You can apply online or in person. Usually each state has a toll-free helpline for applications. Those phone numbers here, I think in Omaha it's 402-595-1178. I've got a couple of questions that I always get. Do revocable living trusts protect assets from Medicaid? Which means like if you set up a revocable trust, will that help protect some assets from the state coming after you or Medicaid coming after you? Another question I always get is a person's home protected from Medicaid forever? so long as the owner has the intent to return home. So what's the answer? Okay, I'll answer. It's fine. Answer one, your assets are not protected from Medicaid in a revocable trust situation because with a revocable trust, you actually retain some control over them, contrast to irrevocable trust. So the advice I always give is an irrevocable trust is what you want to choose if you're trying to protect assets from Medicaid. Answer to question number two, in most states, a person's home is not protected from Medicaid forever if they have the intent to return. A person's home is considered their principal residence if they live there or intend to return. However, if they move out of their home and into some kind of long-term care facility, it is no longer considered their principal residence, and so therefore it's no longer protected. And I see this kind of thing happen all the time. And again, so long as the spouse continues to live in the home, Medicaid will not go after that spouse, but once the spouse passes, that next generation is going to inherit not just the estate, but debt to Medicaid. So it is a really crucial issue, and I think more folks need to know about these kinds of things. A lot of folks, especially as they get older or start facing more and more mental health issues, they're facing these kinds of problems in terms of Medicaid eligibility, and how do you best preserve or protect assets. There are things out there that can help. There's enable accounts, things like that. So I think it's really important for the public to know more about these things and to keep getting that word out. So that's my presentation. Happy to answer any questions. I hope it wasn't too legalese for everyone, but these are just some common questions I get as an attorney, so I figured maybe the broader community needs to know more about them.
Thank you for all of that. There's, as many conversations as I've had around Medicaid, I still didn't know some of this stuff. But I did have a question. When we think about long-term care, so I do often think about, skilled nursing facilities, acute care, post, injury rehab. But with mental health conditions that can often be intermittent, how does Medicaid and the long-term care relationship work on that kind of basis, where someone may need residential inpatient treatment a couple of months at a time, multiple times a year, or over the span because of their personal situation?
Sure. No, and that's not uncommon.
You're good. Keep going.
Okay. I did get a notice that echo canceling is either on or off. Am I echoing too much? That must be it. No, that's a great question, because you really do. The focus should always be on preserving Medicaid eligibility. That's why I briefly mentioned enable accounts, and I was involved in some of the original advocacy over enable back when the state passed it in 2000. I want to say 15. Actually, Nebraska, I think, was like the first or the second state to pass enable, so good for us. First, right? Yeah, that was my recollection. So maintaining Medicaid eligibility so that if you need to go and back and forth is really key. Unfortunately, for a lot of folks, that does mean that they've had to spend down their assets to under that asset threshold. So I think the best thing to do is to engage in planning as much as possible. And try to get everything situated so you're not like constantly having to live in poverty just to be able to keep returning to those kinds of care facilities. And again, enable's an example. There's special needs trusts. There's some other tools out there that you can use. Unfortunately, with special needs trusts, those are fairly expensive to set up. I mean, as an attorney, I might charge $4,000 or $5,000 to do that. Not everyone has those kinds of assets to do that, which is why I think enable was such an important tool, but a lot of folks still don't know about enable. There was a lot of information about enable back when it first came out, 2015, 2016. There was a big press conference at Henry Dooley Zoo when it first happened. But again, yeah, those are the kinds of things you want to keep reminding folks. Like, there are some tools out there to protect assets, but planning is really key.
I was just wondering if you could just take a minute, and if not, I can help with that. But I think for anyone that is watching this broadcast to realize if they don't know about the Enable account, it's about somebody who has acquired a disability prior to the age of 26. So sometimes people don't know that, you know. So if they have had a diagnosis of something with mental health, you know, prior to 26, they can still set up that account. And then anyone in the family can contribute money to that account, which will help them live, you know, more comfortably. And it can be anything that, you know, using those funds for anything that support their disability, including if it means a vacation that helps reduce stress or during seasonal affect or whatever it might possibly be.
That's a really good point. There has to be some nexus between the expenditure and the disability. And it's a really good point. I think 26 is one of those key areas. Like, so for example, if you're trying to get disabled adult child benefits through the Social Security Administration, you're also proving disability prior to a certain age. But it's key. It's a really good point. If you have not set up an Enable account prior to age 26, as long as you can prove that the disability started prior to 26, you are still eligible to do so. So, I appreciate that.
And as you said, no one's going to look at this. Social Security won't look at the funds. Medicaid won't
Right.
look at those funds. It won't impact housing if you have income-based housing. So it's something that people should look at as an option.
Oh, exactly. And I think it's important to remember, even though we mentioned that Nebraska was the first to adopt, it was a federal law, federal tax law first, and then each state had to adopt it. So it negotiates both those federal programs as well as state-run programs. So, yeah. Thank you. Love to be able to geek out about Enable with someone, so I appreciate you being here.
Any other questions for Dave? Or online, anyone with questions?
My email address is davepantos@pantosesq.com. So if you ever have any questions, feel free to reach out to me. And thank you so much for your time, and it was an honor to be here.
Thank you, Dave. All right, Sadie.
I'm really tall, so I'll move these up. Is this good? Yes. Okay, awesome. So, hi everyone. Thank you to those of you, in person and also those of you online for having me here today. I am here to talk about what I think often goes not talked about, which is how to preserve our mental health over the holiday season. And then I also will get into the Kim Foundation, who we are, what we do as well, just to give you a bit of background. So some of our initiatives, we do a lot of things across the metro area. We are different than places like our beloved Community Alliance for several different reasons, but kind of the biggest reason that we are different from Community Alliance is we are not the direct care providers in the way that places like Community Alliance is. Instead, what we do is we focus on education, resources, and then connecting people to those resources. So across the board, we work with everyone. It doesn't matter their age, it doesn't matter their gender, it doesn't matter their background. And we work to connect them to those resources. So some of our initiatives include a Time for Hope and Healing, which is our annual luncheon where we invite a keynote speaker to come and speak on a mental health topic. In the past, we've had Zach Williams, who is Robin Williams' son. He came and spoke. We had Jay Glazer, he's an NFL insider. And then we also had John Gordon, who is a New York Times bestselling author. So each year we invite someone to the metro area to speak on topics surrounding mental health and mental wellness. We also host the metro area LOSS team. So LOSS, as is the case with so many of things in this field, is an acronym. So LOSS stands for Local Outreach to Suicide Survivors. So we call a suicide survivor someone who has had a loved one die by suicide. So that's a bit different than what I think most people think of, which is someone who has survived their own suicide attempt. We call a suicide survivor someone who has had a loved one die by suicide. So anytime someone in the metro area dies by suicide, we get that next of kin contact information from law enforcement. And then we have a team called our lost team who reaches out immediately to that next of kin contact, provides them resources. We have a team of volunteers who can go and provide support as well. So we host that lost team here in the Omaha area. We also host the Metro Area Suicide Prevention Coalition. That's open to anyone and everyone. So we have different breakout groups within that coalition. School members are a part of our coalition, community members, professionals, really anyone interested in working to prevent suicide in the Omaha metro area can join. We host that virtually via Zoom and also in person on 120th and Q at the Project Harmony campus once a month. It's the fourth Tuesday of every month, so it'll be tomorrow morning. So if anyone is interested in any of these initiatives, I should say too, feel free to email or go to our website. We host a couple school conferences that we're always excited to host, and we also have a program called our More Tomorrows program. So because we get that up to the day suicide data in our metro area, we can see which communities are needing that suicide prevention information. So whether that's actual resources, flyers, wallet cards, we have lots of fun fidget tools, or whether that's education and training, we can push out our More Tomorrow's suicide prevention program to whoever needs it in our metro area. And the Be There campaign, which is right next to that More Tomorrow's there, is an offshoot of the More Tomorrow's campaign, but it's specific to those in the service industry. So we know a lot of people don't have access to care. Maybe they can't afford care. And so, maybe somebody talks to their barber, their bartender, maybe the person who does their nails. So we have another campaign connected to More Tomorrow's, which is called Be There. And so that's really just for the everyday person to learn about mental health. And so lots of resources there. And then we also host other youth events. We host the Empower Youth Summit. We just hosted our second youth summit in October, and we had about 430 Omaha teenagers, high schoolers come from 34 different schools across the metro area. So they come together, they listen to a keynote, speak about mental health, and then they also go to breakout sessions. And then we also host a youth advisory council. So anything we do that involves youth, we really try to get the youth voice involved. We want it to be led by them. And so those two things, we really try to get that youth voice involved. Okay, so now that you know a little bit about what we do, I wanted to just get into mental health awareness and mental illness. How do we talk about these things? And then how do we take care of our mental health during the holiday season? So the first thing that I always like to bring up, which is a very easy way to make people feel either included or excluded, is to just be conscious of the language that we use surrounding mental health. So, this is especially, I think, important when we sit down with family members over the holidays, when we're seeing more people maybe that we don't typically see. Our language is important, right? So the first thing we always recommend, which I'm sure is common practice in spaces like this, is people first language. So when we're talking about someone or someone struggling with their mental health, let's say, for example, my mother has depression. My mother lives with depression. I would say it just like that. I would put the person first in the sentence. That's really all people first language is. It's pretty simple. So instead of saying my depressed mother, I would instead just put the person first in the sentence and say my mother lives with depression. And so that's with really anything across the board in terms of mental health. And then we also urge people to avoid using slang words that describe mental illness. This can be hard at times because it's really ingrained in our language, but the more conscious we are of the words we use, the easier it is to stop using them. Probably the most widespread word that is used every day, probably a lot of people have used this today, is the word crazy. We use the word crazy to describe the weather, to describe our day, to describe something that's bothering us. But there are other ones too that come up all the time. Psycho is pretty common. There's lots more, you know, maybe saying someone is OCD because they're really organized, even though they have not been diagnosed with OCD. Maybe calling someone bipolar because they can't make up their mind. Any of those slang words we urge people not to use. And then any nonverbal communication too. So language goes beyond, sorry, I think I bumped something. So language goes beyond just the words that we use. It's also nonverbal communication. So sometimes when someone is bored, they'll mimic putting a firearm up to their head. We urge people not to do that. They might make the widespread, you know, this is known as someone acting crazy. So any kind of nonverbal communication, be cognizant of that as well. And then if you're talking maybe to someone or about someone with, you'll hear me say mental illness, but that person might not like that word illness. They might instead prefer mental health condition. They might prefer mental health concern. Just ask them what they prefer. Those are used interchangeably. All of them are fine to say, but it is personal preference. And then something that we are very, very passionate about at the Kim Foundation, and anyone who works in the field of suicide prevention will say this as well, is working to change the way we talk about suicide with that phrase committed suicide. So probably you've heard in media, among friends, among family members, that phrase committed suicide. We urge people instead to change their language and just use the phrase died by suicide. So we commit two things in this life. We commit crimes and we commit sins. So if we can work to decriminalize that language of suicide, then that just helps to break down the stigma. You know, to put it in perspective, we always say you would not tell someone, my dad committed a heart attack, my dad committed cancer, right? So just working to change the language with which we use to talk about suicide can really work to break down that stigma and just make people feel comfortable too. And so we always urge people as well to think about what their perception is. You know, just because of how the world works, we internalize a lot of language, we internalize a lot of biases that we maybe aren't aware of. And so I always urge people to think of what their perception is of someone with a mental illness. So whether that's in your personal life or professional life, what does that person look like? And then really try to think about, where did that perception come from? Why do you have that perceived notion of what someone living with a mental illness looks like? And then once you start to think about those things, it makes it much easier to open up these conversations, right? Because then you can start to think, well, where did that perception come from, and how do I begin to dismantle those perceptions? So when we talk about mental illness, there are just a couple stats I wanted to go through because it's really, really common to live with a mental illness in America. 1 in 5 adults in the US experience a mental illness each year. The most common is depression and anxiety, no matter the gender or age. So, you know, from kids to older adults, anxiety and depression are the two most prevalent. And of course, there are other more serious persistent diagnoses. And the thing with mental illness is that it's very different from a physical illness. You know, if I break my arm, I go to the doctor. I'm not a doctor, so I don't know what they do, but they set my bone right, they give me a cast. And that's pretty much the same across the board. Mental illness is different because recovery looks different for everyone. And so it's really up to that individual to find a personal treatment plan that works best for them. What works best for one person might be completely wrong for another person, right? So just knowing that it's an ongoing process, but that hope and healing are out there and that treatment is available is really important. And so I think it's also important to know where mental illness comes from. Again, it's much more complex in some ways than physical illnesses, right? But ultimately, when we try to sum it up into these categories, there are 3 main categories that kind of come to mind. So the first is surrounding. So any kind of trouble in the family, divorce, poverty, any kind of parental drug or alcohol use, and then, of course, any military combat or assault. So it can come from our surroundings, something that happens to us. It also can come from the mind. So any kind of childhood trauma rewires the brain. And so any abuse of any kind, neglect, early loss, anything like that. And then it also can come from the body. So that could be, a traumatic brain injury, genetics, an ongoing chronic condition. So those ongoing chronic conditions, important to say that those don't scientifically cause a mental illness, but because someone lives maybe with that ongoing pain, or those just ongoing circumstances of living every day with that chronic condition, then they are at higher risk for mental illness, if that makes sense. So with all of that in mind, that's just on a normal day and every day, right? And then when we compound what a lot of people go through with the holidays, maybe family issues, maybe it's just a total disconnection from family, especially when we pair that with the pressures of spending and the pressures of social media. Mental health historically falls in the holidays for lots of people, right? And so what can we do? The first thing that we always recommend is to recognize your feelings. Just because we ignore something does not mean it will go away. In fact, it probably will get worse. So recognize what you're going through, recognize how you feel, and then remember that it's temporary. So especially in the holidays, once the holidays pass, it's easy to know that those are temporary, but really any negative mental health struggle that you're going through is temporary, right? But especially in the holidays, remember that it's a temporary season. We'll get through it like we do every year. And then also, it's really important to maintain your regular wellness practices. So this goes for yourself individually or for anyone you know. If you know a friend, a loved one, a family member who struggles during the holiday season, encourage them to maintain regular wellness practices and maybe engage in those wellness practices with them. It's really easy to disconnect from people, especially when you're doing all the things that you need to have done for your family with the holidays. So check in on each other, be accountability partners for those regular wellness practices, and then also just seek support. So if you're experiencing mental health struggles, don't wait to get help. How you choose to receive help is up to you and your preferences. We always recommend 988, the new-ish. It was created last year on a national level, but the 988 Suicide and Crisis Lifeline is a great resource, whether that's text, whether that's calls. So we always recommend 988, but it doesn't have to be 988, right? It can be texting someone, checking in on them, and just saying hey, we're gonna meet every Tuesday for coffee. I just want to check in on you. Any point of connection can go a long way in terms of helping someone's mental health. So we encourage you to do that. And then just know that with the right support in place, you can find ways to feel better, to feel like yourself, even in this busy holiday season. So I will leave these resources up. These are just some of our metro area and national resources. But does anyone have any questions?
Thank you for all of that, Sadie. I just want to comment that in a lot of the trainings I do, when we're talking about reducing the stigma around mental health, and language is one of the first things that I touch on. But I want to share it, it really, because you don't know people's journey,
Mm-hmm.
it really just encouraging everyone to be an advocate in that way, because no matter the audience, you can have a role. For example, my kid's school was everything was crazy hair day, crazy sock day. Communication was going out in newsletters and on the Facebook or your social media pages. And so I just went to the administration and just raise their awareness to the impact of using that word. And it was one of those really easy things for them to commit to and communicate out. Review your communications before you send them to families or whatever. We are no longer we are not using this word in any official communications. And so small audience, but you can do it on small scales that trickle out and raise awareness. So I appreciated that element of your presentation. With all the different programs and stuff that you mentioned, do you do any work with employers around reducing the stigma around mental health in the workplace, or to influence their hiring or recruiting efforts?
Yes. So first of all, we do have a professionals breakout group in that metro area suicide prevention coalition. So we have several local businesses and corporations with employees attend. So Union Pacific, I know, is one of them. Shields has been really involved with the coalition, but we also present to several local businesses and corporations in the Omaha metro area. And that annual luncheon is really aimed, especially last year, is really aimed toward working age professionals, because actually that population is the age group with which we see the most suicide deaths nationally and also here in Omaha. So we target that age group quite a bit.
Thank you.
Yeah.
Any questions for Sadie?
I was just going to thank you for the presentation. I was aware of the Kim Foundation, but not all of the services, and I appreciate the list of resources.
Yeah.
There were a couple that I wasn't aware of.
Yeah, awesome. You know, and to your point too, I think a lot of people just don't know how to have the conversation surrounding mental health. They don't know the language and words to use. So just gentle reminders, like you talked about, can make a world of difference.
Fantastic. Any
Awesome.
questions or comments from our online attendees? No? All right. Thank you so
Awesome.
much.
Thank you.
Lots of great information and resources shared today. Appreciate all of our presenters being here today. Really no old business to close out with. We're kind of at time, so no time for announcements either, but just a reminder that the next we won't have a meeting in December. Our next meeting will be Thursday, January 18th from 10:30 to 12 p.m. We are shifting our schedule in 2024. So it'll be the third Thursdays every other month from 10:30 a.m. to 12 p.m. Thank you to Jamie, our sign language interpreter, and Cox Communications for taping and broadcasting. Cox Channel 22 on Monday evenings will be the replay at 5 p.m. And the live broadcast happens on Cox Channel 18. So thank you all for being here, and we are adjourned.